And good afternoon, everyone. I'm Tom Griffith. We're on the air breaking in with news. Governor Sununu is updating the state's coronavirus response. Let's listen in.
He's out there and answering a lot of the questions that I know a lot of folks have, even though the holiday season is upon us. That's very exciting. I think it's going to be a good week for everyone. And we appreciate folks for joining us on Tuesday. I know it's a little earlier than normal. Let's kick things right off with a public health update from Ben.
Great. Good afternoon. Thank you, Governor. So some of the numbers. We are announcing 624 new people diagnosed with COVID-19 today. 484 of these are people that tested positive by PCR testing, and 140 individuals tested positive by antigen testing. In the last week, we've been averaging about 750 to 800 new infections per day. This is stable and down slightly from the numbers last week. But currently in the state, there are 6,485 people with active infection. Our test positivity rate remains stable at 9.1%. Again, that's the average over the last 7 days of both PCR and antigen tests combined. Unfortunately, the number of hospitalizations is up. There are 297 people currently hospitalized statewide with COVID-19, and thankfully 0 new deaths to report today, but the total number of people that have died from COVID-19 remains at 656. In the last week, however, there have been 52 people that we have announced that have died from COVID-19. So given the holidays and the potential for people to travel and gather with others outside of their immediate families, the numbers remain at risk for going up, both the numbers of infections, hospitalizations, and people dying from COVID-19. So it's critical not for people to let their guard down now or over the next few months, especially as we have vaccine increasingly available over the coming weeks. Vaccine will be the most important tool and the most important measure that we have to stop this pandemic. And Dr. Daly in just a minute is going to give an update on some of the vaccine numbers. But until we have a high level of vaccination across our state and across our residents, people need to continue to follow the community mitigation guidance, which is primarily how we're going to continue to prevent the numbers from going up, hopefully drive the numbers back down. So we continue to recommend and encourage people to avoid or postpone any unnecessary travel, avoid gatherings over the holidays if at all possible. If people are gathering and with other people outside of their household, to try and stay at least 6 feet away and wear masks, even if that's indoors. And certainly if somebody has any symptoms, any new symptoms of COVID-19, even if that's simply a mild cold, we do ask that people and recommend that people get tested for COVID-19, because we know that symptoms of COVID-19 can range from mild symptoms to more severe symptoms. These steps are still the measures that we have to control spread of this virus until we have wider vaccination and vaccine available to our population. So I'm going to hand things over to Dr. Daly. Thanks.
Great. So good afternoon. I'm going to provide an update on our vaccine distribution efforts, starting with what happened last week, and then I'm going to talk about the week ahead. So over the last week, we've distributed 4,505 doses of vaccine to all of our hospitals in our state. This represents 92% of the vaccine that we allocated to hospitals this last week. The hospitals have used this vaccine to vaccinate 3,819 of our frontline workers to date to protect them from COVID-19. On Monday, December 28th, we'll begin reporting these data publicly in terms of how much vaccine has been distributed to the hospitals and how much each hospital has administered. The big news is that over the weekend, Moderna's vaccine received emergency use authorization and is now approved for use in people 18 or older. This vaccine requires 2 doses, 28 days apart. Like the Pfizer vaccine, it's very effective, and after 2 doses, it's been shown to be 94% effective at preventing COVID-19 disease. Like other vaccines, people who receive this vaccine can expect to have pain, redness, and swelling at the injection site. A smaller number of people may feel tired, have muscle or body aches, fever, all of which will resolve quickly. These are signs that your body is responding to the vaccine and developing the antibodies that will protect you from COVID-19. Today, we received 24,200 doses of Moderna vaccine in state here in New Hampshire. About half of this vaccine will be distributed to our hospitals so that they can continue vaccinating those healthcare workers that are at highest risk. And about half are going to be used to launch our state-run fixed vaccination sites, as well as our mobile teams, which will be run by our regional public health network partners. The state-run fixed vaccination sites are set to open next week on Tuesday, December 29th, at 13 locations across the state. These sites will begin vaccinating our high-risk ambulatory care providers, those healthcare providers that aren't working in hospital settings, as well as our first responders. We're asking people not to reach out to us and ask how they can be registered for receiving vaccine at these sites just yet. We're actually working directly with those first responder agencies to register their high-risk staff, and we'll also communicate broadly when we're ready to begin registering those ambulatory care providers. In addition to the Moderna vaccine, we were allocated 8,875 doses of Pfizer vaccine this week, which has been primarily directed to support the federal long-term care facility pharmacy partnership program. And this program started this week, yesterday, Monday, December 21st. Between CVS and Walgreens pharmacies, they've begun vaccinating a number of different facilities across our state this week. We don't yet have confirmed allocations in terms of how much vaccine we're going to receive next week or any week after. However, we've been told to expect approximately 9,000 doses of each of those two vaccines, Pfizer and Moderna, for a total of 18,000 doses over the next few weeks each week. This number is absolutely subject to change, and we don't get our exact allocations until the week before we receive it. We hope to have higher allocations made available to our state as other vaccine formulations become available. So based on our anticipated allocations, we expect to vaccinate all of our Phase 1A persons with at least one dose by the middle to end of January. So remember, again, those are our highest risk healthcare workers, our residents and staff of long-term care facilities, and first responders. At that time, we would expect then to begin vaccinating those who are in Phase 1B, and we're working on developing who is going to be included in that phase now, and we will communicate this when we have it ready for you. It's going to take us several months to get all who want to be vaccinated, and this means that we must remain vigilant in the steps we take as individuals to prevent COVID-19. Thank you.
Good afternoon. I'm just going to do a brief long-term care update and outbreak update. So today we are closing 5 long-term care outbreaks: Evergreen Place in Manchester, Hackett Hill in Manchester, Maple Leaf Healthcare Center, Manchester, St. Anne's Rehab and Nursing Center in Dover, and St. Joseph's Residence in Manchester, all closed. We are announcing 4 additional outbreaks today. We have Golden View Healthcare Center in Meredith opening, Keystone Hall Cynthia Day Program in Nashua open, Northern New Hampshire Correctional Facility in Berlin open, and the Wentworth Senior Living in Portsmouth open. That's all I have. Thank you.
Great. Thank you, Commissioner, and Dr. Daly and Dr. Chan. A couple things to kind of review, and then we will open up for questions. There were a lot of discussion today surrounding the relief package within the recently passed federal omnibus spending bill. So I think there's a bit of confusion that this coronavirus relief package was a standalone. It really was not. It was combined with another $1.4 trillion in terms of the omnibus spending bill, keeping the government moving forward, at least in the short term. And obviously, we're still digging into the legislation. I think the total package was over 5,000 pages. I think it was only as early as yesterday that it was made available for folks to read it. Don't ask me how they voted on it without reading it. I'm not even going to get into that. That's unfortunately a long-term problem that Washington has. But we do expect some additional clarity in the coming days. And I think hopefully we'll be able to get a better sense of some of those true relief efforts that we can expect specifically out of the COVID aspects and relief aspects of this bill. But there are definitely some good news within this bill. There's no doubt about that. There is funding in there for everything from vaccine distribution, PPE procurement, contact tracing, tens of billions of dollars for schools across the country. Rental assistance programs got billions of dollars of support. Substance use disorder, child care provisions, transportation. So a lot of really good stuff in there that will handle some of the cost that right now states are bearing. The federal government is going to come in and support specifically around the COVID pandemic. Regarding unemployment, it does look like that they will be re-upping the $300 per week unemployment stipend for an additional 11 weeks. So that's good news. While we have been doing very good with our employment statistics here in New Hampshire, I think we're ranked 5th in the country for unemployment. That's very good news. We're on a very good track. But there are still a lot of Granite Staters that are out of work, and this extra $300 per week in the unemployment stipend, at least for the next couple months, few months actually, will I think is well encouraged relief. I guess one of the most frustrating parts of this, only if there's any criticism to be had. I mean, again, we'll dig into it to see what other spending there is, but it is frustrating. I think a lot of people share that it did take so long for this to get done. One thing they were touting was the flexibility that states now have with CARES Act funds. They passed that flexibility with a week to go. So most states have actually spent all of their CARES Act funds. So needless to say, that type of when you see Washington trying to take a victory lap without truly understanding the pushes and pulls of what happens at the state level, it can be very frustrating. And I think I speak for all 50 governors in that realm. But we are happy that they got something done. We'll keep digging into it, as I think everybody will, to have a better understanding. There's a lot of money and a lot of support there, and we're going to make sure that every dollar of it gets to exactly where it is intended to go. What we do know, and what we were discussing a little earlier, that is moving forward from Washington is the vaccine. And as was discussed, we did receive our 24,000 doses of Moderna today, 9,000 doses of Pfizer. With the long-term care facility program, for the most part managed by CVS and Walgreens, is moving forward this week, which is terrific. We know a lot of folks are still getting their consent forms in and things of that nature for their loved ones in long-term care, and we highly recommend folks do that as soon as possible. I believe the vaccinations up at our Veterans Home are going to be taking place as early as this week, which is great. We're making sure that those folks are a priority. There is some things are definitely trending in the right direction at our Veterans Home. I think as of today, we have about 21 residents and staff that are COVID positive. Originally, I think there were about 190, so we're down to about 21. But there has been a lot of loss of life up there as well, and those veterans. Those are our heroes, and God bless the staff. Commandant Lebrecht and the staff on the front lines have done a tremendous job. We've been with them every step of the way. Whatever they need, we get them, but they've really been dealt a tough hand up there, but they really have done a great job mitigating the spread of the virus, and it seems as though we're on a very positive path. But we just, again, there are still some residents up there that are COVID positive, and any prayers that we can go out to them and wish them a speedy recovery goes a long way, to be sure. Another important announcement we are making today surrounds our schools, and something we've been talking about a bit, but we know that as kids and teachers are on a well-deserved winter break, we know they've done a great job managing the COVID crisis as it pertains to schools and trying to keep their schools open. There could be a lot of questions as kids are looking to come back to school into the new year. So with that in mind, we're making sure that testing for students and teachers and staff within those schools are prioritized as they do head into the classroom in early January. And as we know, there have been a few cases associated with schools. There have been clusters around schools, very few outbreaks, which I think, again, is a testament to the guidance that we've put into place and the success that we know we can have within schools. But many test sites across the state will now prioritize appointments for teachers and students and staff with symptoms of COVID-19 within 24 hours. So individuals will either receive a rapid test or a PCR test, and if a PCR test is chosen, the provider will send the test to another lab in New England that can get those faster turnaround times. We just want to make sure that students that may require a test to get back into school aren't being held back 3, 4, 5, 6 days or even a week while they're awaiting those results. We want to make sure those kids can get back into class as quickly as possible. We just know that when symptomatic students, teachers, and staff have access to these timely tests, in-person learning can quickly resume, and the benefits of that have been proven out to be just enormous. So individuals can go to nh.gov. Oh, you see a little map next to us? That's great. That's our testing map. You'll see that's something that you can see right on our website, our nh.gov/COVID-19. You click Get Tested right over there, the little blue button, and they can access that testing map, and you'll be able to identify yourself as a school staff member or a student with symptoms, and anyone who does should expect to get an appointment within 24 hours. So it's a great development, and just making sure, once again, that with all the flexibility that we've been able to build into our system, that allows us to prioritize areas of highest needs, and making sure teachers and students have access is obviously a very high need, given the success that they've created for themselves within the school system here in New Hampshire. So before we close out, I just wanted to provide some just brief words on the upcoming holidays. I don't think it's anything that folks haven't heard before. You know, we did a great job as a state over Thanksgiving. We saw a little bump in the numbers, excessive bump in the numbers after Thanksgiving. It wasn't nearly as bad as I think we thought it could be, and definitely not as bad as you saw in some states. And I think folks understood that they had to limit their gatherings with immediate family. They had to be a bit innovative. They had to change what they traditionally do around Thanksgiving. And of course, we're asking folks to do the same over Christmas. Now is the time to stay most disciplined. Now is really the worst time, if you will, to get COVID and to pass COVID on to others, knowing that a vaccine is here, it's underway. We're simply a few months away from really getting that relief that we need across our entire system through vaccine distribution. And so knowing that, we're just asking folks to stay disciplined and keep up kind of those good habits, hopefully, that we developed over Thanksgiving. So as we take it into Christmas and the New Year's, just a reminder that it's wearing your mask, social distancing, washing your hands. It's not about us. It's really about our loved ones and our coworkers and our extended family that we really risk by spreading the disease, either symptomatically or asymptomatically. So we just ask folks to try to make the best decisions. We're not going to mandate. We're not going to force people to celebrate their holiday in a certain way or not in their own homes. We don't do that here. But we are asking them to be disciplined and make good choices for themselves and their loved ones. And then, of course, we do have a very significant out-of-state worker that will be coming in that we will be deeming essential, and of course that's Santa Claus. We did it for the Easter Bunny, and we want to make sure Santa knows that there will be nothing holding back here. So we're deeming Santa Claus an essential worker. He will be here on time, much like the vaccine has been, which is good. He's not coming from Washington, so that's the good news. So that means he'll likely deliver on everything he promises us. So we think it's going to be a good holiday. We really do. The ski season is out there. People are out there snowmobiling. They're doing a lot of these very healthy outdoor activities. We just ask folks to enjoy everything New Hampshire has to offer, but do it in a safe way, do it in a responsible way, understanding that we still have a pandemic, and hopefully enjoy the holidays as best we all can. With that, we can open it up for a few questions. I was going to say good morning, good afternoon, Paula. How are you?
Merry Christmas.
Merry Christmas, Happy New Year, Happy Hanukkah, Happy Festivus.
I was going to ask about whether he would have any troubles at the border, but
No troubles with Santa. He gets a free pass.
good. I don't know. I'm hearing that somebody's not getting a free pass is the CVS, Walgreens, and the slow rollout, according to some nursing homes and long-term care facilities that would have liked to have seen the vaccines in the arms of their loved ones as early as Monday. How do you feel this is working? Is it working as you expected? And are you concerned about the public-private partnership?
So we have always said that the long-term care facility vaccination program would begin on Monday, and it did. It was rolled out Monday. Again, we don't have enough vaccine for everybody in Phase 1A today. That's 100,000 individuals. We use every bit that we get. We kind of split up between hospital workers, long-term care facilities. Within those facilities, they then cohort it amongst their staff and the residents. Those facilities will not be giving all of their staff all of their vaccine at once, because in case folks have side effects or maybe have to take an extra day if there's any sort of side effects like that, you don't want all your staff going out. So we've recommended, and the CDC has recommended, to kind of cohort your staff as you roll out the vaccine within your facility. But that process is underway, as was always anticipated. It's on time, and we're allocating as much vaccine as the federal government's willing to give.
For when you'd like to see all of the long-term care residents and staff vaccinated?
I think I hesitate always giving a date because I don't want folks to put it into concrete. But I can tell you, if we get the vaccine at the rate we anticipate getting the vaccine, and that's all subject to change. And Dr. Daly's very good. I know she's sweating over there as I start making predictions on vaccine distribution. But I think by the third week in January, the vast majority of Phase 1A will at least have had their first shot. Then there has to come the second shot, and even some of the individuals that received their first shot a week or two ago may be getting their second shot by mid to late January, which is good. But that's the general time frame when I think we would like to see all of Phase 1A be done with their first shot, and we can start with kind of moving into the first shots into Phase 1B and Phase 2. But that's obviously subject to change, but I think that's the relative time frame we would like to see.
Governor, as you know, a couple hours ago, Massachusetts Governor Charlie Baker limited social gatherings, public and private, for 2 weeks, non-essential hospitalizations, and also set capacity limits at almost all businesses for the next couple of weeks, with 82% of their ICU beds at capacity. I know you're following this here. Are we anywhere near that kind of danger zone, and do we need to consider thinking about any similar restrictions?
So we've always said that as we kind of hit that peak of our numbers of COVID, and hopefully we've hit it. We've seemed to have stabilized over the last week. We want to be cautious, but we seem to have stabilized. Now we know that the hospitalizations and even the fatalities will lag our numbers. That curve will lag the second curve will lag by about 2 to 3 weeks potentially. So, in saying that, yes, hospitalizations will likely continue to go up at some level. I don't think we're just below 300 hospitalizations today in our census. It's manageable, but we're getting up there to be sure. My sense is that will continue to grow at least slightly over the next week or two. But no, we're not at the point where we need to start mandating more economic contractions or things of that nature or pulling back. We are in constant communication with our hospitals. I think they've been doing a great job, and hats off to them. A lot of them are making a lot of sacrifices, moving certain patients over here, sharing beds and sharing capacity. I think they all appreciate that we are all in this together, and they're working as such, and for that, I really do commend them. I think at least a half dozen to a dozen of them are really at or near capacity with a lot of their services, and so some of them have chosen to pull back. We're not looking to mandate a pullback on some of those services just yet. We can always open our surge facilities if necessary. But the numbers, whether you restrict public gatherings or you restrict businesses today, the hospitalization number is likely going to keep trickling up, right? Because that's just the way that the math works. It takes a week or two for some of those symptoms to get very severe in folks. And so that's likely what we'll still see is some potential increased hospitalizations over time. But hopefully we're at a peak, and maybe we'll start seeing a downswing. It's a little weird. The good news is this second surge has occurred exactly as we predicted back in August and September. The bad news is that the second surge happened exactly as we predicted back in August and September, meaning that it happened as we thought, but the numbers are really high. And it's really aggressive, and we knew it would be. We were prepared for it, and I think the folks at Public Health and the hospitals themselves deserve a lot of credit for being prepared. And we're just in a very different situation than we were in March and April, and we're a slightly different situation than Massachusetts, to be sure. So they have to find their path and make their choices, and we have a little more flexibility on our end to make ours.
Governor, it's been a long 10 months, to say the least. People are stressed.
Has it been 10 months?
I think it's 10 months. People are stressed, they're tired. It's that time of year where you want to gather to maybe alleviate some of that stress and see your loved ones, but it's a dangerous time to do that. What do you sort of say to the people who are alone? They're stressed, they're tired, they're at the end of their rope here.
It's hard to ask, when folks have given 110%, it is hard to ask them for a little more. But it would be irresponsible for us not to. That's the way it is, and we're not asking them to do anything that we're not doing on our end. I can tell you myself, and I can't speak for our entire team, but I'll pop in to see my folks. I pop in to say hi to them once a week, whereas I used to go over and have the grandkids play with them all the time. And now it's kind of a pop in for 5 or 10 minutes, socially distanced, and see how they're doing and move on. And Christmas and Christmas Eve will be the same way. So we really want to emphasize, at least here in the state, I can't speak for other states or what's happening in Washington, but we're not asking them to do make any additional sacrifices that we're not willing to do ourselves, and it is tough, especially for the elderly. We have a lot of elderly that they just live alone. And they live very well, and they can live independently, but it's been extra hard on them because a lot of their social groups or their gatherings, rely on technology, and we're trying to get everyone up to speed with using Zoom. But that's hard too. Not everyone has the best access to technology all the time. So we know the sacrifices that people are willing to make. There's a lot of mental health aspects to the loneliness. To that isolation, which is why we try to keep things open and moving forward as best we can with that balance. But it's a tough time during the holidays. We get it. We're at the beginning of the end, though. There really is a light at the end of the tunnel. Stay disciplined a little while longer, especially as we get through this first phase, where are far and away the 100,000 of our most vulnerable individuals. If we can provide them the protection that they need and deserve over the next 6 to 8 weeks, I think we'll all be able to take a little more of a collective breath. We'll still have to be disciplined, but I think that light at the end of the tunnel gets a little brighter and brighter every day. So hopefully that gives people some reassurance that we are. If the vaccine weren't there, I think it would be all in a lot tougher position mentally, right? I think we'd all say, gee, how long is this really going to go? Maybe it never ends. But I think we now know that it can and it should end. The vaccine is safe. It's being taken at a very high rate. It's being delivered. When 30,000 vials showed up at our doorstep this morning, that was pretty awesome. That really was pretty awesome between yesterday and today. And I don't think any of us thought it was going to be here even by New Year's. But we're already well underway. So we hope people see that as a light and a bit of hope. And we're just asking folks to stay disciplined a little longer.
Can I ask a question about the legislature and any updates on related to COVID-19? There was a post on a Facebook page among a legislator who was asking for prayers very seriously in the hospital. Could you just give us sort of an overview on where things stand with as much as you can on?
Sure. I do know. I can tell you just from a personal standpoint. I do know there is at least one legislator that is in the hospital, and obviously we sent all the prayers to them and their family. It's really tough when you enter a hospital setting. It's a really tough thing. If you've seen what those folks have to go through, so we're wishing them the best. And I don't get any updates as to which legislators are positive and which ones aren't. We are providing testing as much as they want to be tested. I do know the legislature is looking at different options in terms of how they will meet. I don't know if any resolution has been determined. You folks may know even better, more than I would. So I'm not sure where they are in that process. But I know they're looking to do it, and they're looking to do it safely, and that's reassuring.
Would it be a good idea to wait until February or March for them to get actually to work once most of them perhaps have been allowed to get the vaccine? And
well, if they can work remotely and safely or socially distanced and wearing masks and doing all the provisions that we require of any other large group gathering, then they should be able to do so. As long as they can vote and have the public hearings and do the business of the legislature. My sense is, and this is just my sense, they're looking at a fairly abbreviated schedule through January, doing only their most highest need activities until you get to the February-March range. So my sense is they're taking that approach. I mean, you'd really have to ask them.
But they could get a continuing resolution on the budget, perhaps, for a few months instead of the normal deadlines that were set, I suppose.
Yeah, the budget doesn't need to be done by until June 30th. I mean, I think we'll have plenty of time to get the budget done. I'll be presenting my version of the budget by February 7th or 8th. So if they just vote that up, we'll get it done by, February 9th. It can be that easy. So I don't think that's really going to happen. But my point there is they will have plenty of time, I think, to dig into it, work. They can do remote stuff. I think the hardest part is the public hearings aspect of it, because you want public input. We don't want to be in a situation. Last year, I had to veto a lot of bills that were these massive omnibus bills with 40 different bills piled into one that didn't even relate to each other sometimes. And there were some good bills in there that ultimately got vetoed, but a lot of times it was because they didn't have appropriate public hearing. And so we just want to bring those back this time around and hopefully have another shot at them with the public input, because that's a very important part of the process.
Governor, we know there are some schools that have sports teams in quarantine right now, Bedford being one of them. With this surge happening, should kids be playing indoor sports right now, or should we hold off maybe until spring?
In terms of school sports?
School sports, yes.
Well, I think, again, schools can make their own choices. There are safe ways to do it. If they follow the guidance, they can be successful, there's no doubt. But we recommend that they're testing their kids, that they're staying right on top of it, finding out, who's symptomatic, who isn't, making sure that communication is there. And if quarantine or other provisions have to be taken, then they should absolutely be taking those. But.
And I just had a question about some positive cases at DHHS Ops Center. I'm not sure if Commissioner Shibanet or Dr. Daly wants to take this one.
That was a question request.
We just heard there were some positive cases at the Ops Center. Any information on that? What guidelines are in place to make sure folks there are safe? And with folks getting sick there, do you have enough people to continue working?
Sure. So DHHS, both the Ops Center and our district offices and Brown Building and all of our frontline staff, they're at the same risk as everybody else in the community. We're really just a microcosm of society overall. So yeah, we've had positive cases at DHHS throughout the pandemic here and there. And we do have some current positive cases in our Ops Center for COVID. Public health, as you would imagine, does a great job social distancing and with mask wearing. So we've really limited the spread in those cases. Those staff go out and they go to the same grocery stores and do the same thing we all do. So having positive cases isn't completely surprising or atypical. So as of right now, we think it's pretty much contained. But DHHS's staff and employees are no different than anybody else. We have plenty of people to do the work we're doing. We're not understaffed at all, and we're still staying on top of everything we're doing.
As far as vaccinations for teachers, I know Phase 1B is kind of in the works right now, but do you think they'd be included in that? Especially with now testing priorities for students and teachers.
I think, we've gotten a lot of requests from essential workers to be considered for 1B, everything from utility workers to environmental service workers. So I think that is that's an undertaking that we're starting right now to look at what place in 1B, because in a lot of ways it's going to be whether it is the beginning of February or the end of February. It's not whether someone's included or not, it's what position do they hold in that. And so we really don't want to make winners and losers, but we want to look at who's at most risk for coming into contact with COVID, and then also who's at most risk for having negative outcomes to COVID, which is why the long-term care facilities are getting the vaccine first.
The governor, the commissioner, but we're getting a lot of calls from people involved in the prison system, whether inmates themselves or loved ones. They're concerned that they're not getting access to the health care they need. They're concerned about distancing. Is that a concern that's being looked at, or?
Well, I can tell you that the high risk, the kind of those frontline workers within the prison system are part of the congregate living, first responders, if you will, that we're going to make sure that do get vaccinated.
Are there concerns about the inmates who say, I'm not getting the treatment I need or the testing I need, or we're too packed in there? Are those being looked at?
So we're providing a lot of testing within the prison system. We know there have been some outbreaks there for sure. I think they've done a pretty good job containing them in a couple different settings, both some of the smaller county jails as well as some of the larger prisons that we have. I think that the staff is doing a great job, mitigating and containing. But we're making sure that the testing is available. They can identify, who might be asymptomatic or symptomatic, who's positive, who isn't. Making sure that those individuals go into some sort of medical isolation. And then if their symptoms are severe enough and they do require additional medical care above and beyond what the prison can provide, they are transported to a hospital, and that is happening. So we have prisoners that have that needed some additional care and have been utilizing a few of our hospital beds as well, under security, of course, and close watch. Do we have some on the phone?
Yes, Governor. We do have some folks on the phone with questions, and the first one comes from Holly Raymer with the Associated Press. Holly, please go ahead with your question.
Hi, thank you. Dr. Daly talked a little bit about working directly with first responder agencies to get them ready for the vaccine. But when we get to later phases, the phases that include workers in essential industries or older adults, how does the state plan to notify the next priority group that they're eligible?
Sure. So I'm going to have Dr. Daly come up and talk just a little generally about that.
So as we develop the plans for future phases, we will communicate broadly with everyone, including all of you, letting you know which phases of our vaccination distribution plan we're at. And we will provide detailed instructions for how people can register. We're working with those first responders for them to be able to roster their employees that need to be vaccinated as part of this first phase. But that might not work rostering individuals with companies for the larger distribution plan, and we'll have an online registration process where people can be put into line in order to get vaccinated and schedule at where they want to receive that vaccine from. So it'll be broadly communicated through many different platforms.
Thank you. Sure.
And Governor?
Sorry, can I take 1 second? I'm Ben and Dr. Daly, so just, I'm not sure what's happening. There's a couple bees over there, and I just want you to be aware of that and just be careful. It's, I don't know how we have bees in here and in the middle of winter, but I just want to make sure everyone's aware. I don't want anyone to get stung. Sorry about that.
That's okay.
Health and safety, it's what we're all about here.
Okay. So the next question, Governor, comes from Rick Green with the Laconia Daily Sun. Rick, go ahead with your question.
Okay, I have a main question and a follow-up. If the federal government does not provide direct aid to state and local governments, what kind of cutbacks will be required, and what are the chances that layoffs will be needed by some state and local workers, including police officers, firefighters, and teachers? And the second part is, State Representative Don Johnson linked on social media to an anti-Semitic election conspiracy post from a neo-Nazi website. Do you favor her serving in the state legislature?
Okay, so the first question, sorry, I got the one on Don. The first question is about layoffs. Sorry, potential. If the federal government doesn't come through and provide any sort of relief for states and local governments, obviously we hope that they do. New Hampshire's done a great job, and I can only speak for our state. We've done a great job in terms of managing the budget. So you'd have a whole of somewhere around $50 million. We could use our rainy day fund, that's what that's for, to kind of cover some of those back end issues from the previous budget. We'd have the ability to do that through June 30th, and we have plenty of money to do that. And then going forward, it's just about good management. I don't think we anticipate any massive layoffs or anything like that. I don't think you're going to see any major cutbacks or anything. I think it's just about finding efficiencies in the system, being disciplined about your spending. We still do have a lot of COVID relief dollars coming in that are helping supplant not what we're currently spending for just traditional state costs, but making sure that we're covering all of our COVID costs so there's no additional extra burden on our system there. So even if the federal government doesn't come through, I think we've managed very, very well, and we're going to be in good shape. We really are. I still fully plan on, whether the federal government comes through or not, we're still fully planning on presenting a budget with tax cuts in it to really boost the economy. You have a lot of businesses moving in here, a lot of economic opportunity, and those are really the things kind of July 1st forward, because that's what the new budget will really be looking at, July 1st forward, that we look at in terms of the revenue expectations for the state. And right now our economic outlook is very, very good, considering all that we've had to go through over the last 12 months. As for this Don Johnson and this post, it was a disgusting post. It was anybody who's in a position where they're of leadership, where they're reposting things from websites like that, it's completely reprehensible. I don't know. You can't put a strong enough word of enough hyperbole on it in terms of those actions. And I don't work with anybody that kind of lives in that realm.
And Governor, the next question comes from Carol Rodo with the Manchester Ink Link. Carol, please go ahead with your question. Carol? We'll try that back in a minute.
Okay.
Let's move on to Matt Layton, who is with NBC5. Matt, please go ahead with your question.
Thank you. Governor Sununu, just want to get your reaction. Saw some posts on your Twitter and Facebook feed over the weekend in regards to some members of Congress getting the COVID-19 vaccine ahead of, including here in New Hampshire, ahead of some of those who are in long-term care facilities or on the front lines in hospitals and other medical fields. Just want to get your reaction to those members of Congress who have already received the vaccine.
Well, I guess, I think what I posted out and what I've said publicly really stands on its own. I think it's despicable. I think that anyone who thinks that just because they're an elected official thinks that they should go before a nurse or an individual long-term care facility has a really convoluted understanding of their self-worth and self-importance. And I know that sounds like we're using hyperbole, but I got to tell you, we are scraping for every last dose of vaccine we can to get through these individuals. And I think of the individuals sitting in a long-term care facility right now who are finally getting the vaccine, waiting for their number to be called. Now's the toughest time that potentially those individuals could get COVID. So every vial that we can get out, every last bit that we can get out to the areas of highest need, it's really vitally important. And I saw some of the posts of these individuals, these politicians in Washington getting the vaccine, and I just think it's a very, very important message that people understand how serious this is and how serious it is, how important it is that the vaccine go to exactly where it needs to be.
And Governor, the next question comes from Michael Graham with New Hampshire Journal. Michael, please go ahead with your question. Michael? Strike two.
Maybe he's hanging with Carol.
We're going to move on to Jordan Haim with New Hampshire Public Radio. Jordan, go ahead with your question.
Hi, I have one question, and I would also ask that you please come back to me after for a follow-up. But New Hampshire saw a pretty undeniable spike in COVID cases and hospitalizations in the weeks after Thanksgiving, as the state's own data shows. And some hospitals in the southern tier are now saying that they are pretty much operating at capacity, and they're definitely expecting another spike after the holidays this and next week. So the state's planning, as you've described it now and in recent weeks, seems to be based on how to respond to increases in cases and hospitalizations. But is there any proactive strategy to prevent these increases from happening? And at what point will you take further policy action to prevent these hospitalizations and deaths?
So let's be very clear. We've been taking proactive measures all along to help reduce and minimize the surge that we knew was here. Every step that we take, every day that goes by, we're looking at the data, looking to see what else can be done that can be effectively used to help manage not just the hospitalization rate, the fatality rate, the outbreaks that we see in a lot of the different facilities that are out there. We took the very aggressive move prior to Thanksgiving to putting the mask mandate in place. We're seeing some of the benefits of that. Now our numbers have, over the last week, have stabilized, even come down a little bit, which is really good news. Was there a bump after Thanksgiving? A little bit, to be sure, not as big as some other states. Do we expect another bump potentially after Christmas? Yes, we do. But right now, we don't think it's anything that we cannot manage. I think the team has done a very good job making everything from testing available, getting results back quickly, the contact tracing that we, even with the thousands of more cases that we deal with today than we were dealing with just a month and a half ago. The team continues to do a very good job on the contact tracing, working with Manchester and Nashua and some of the schools that are doing their own. It's a very good system. So all of these are tools that kind of go into place to make sure that we're being proactive as proactive as we can, making sure that if folks have a need, we're there. When hospitals needed some more dollars so they could, find some more capacity, we provided more funding. When UNH needed more dollars last week because they were doing more testing for us, we provided more funding. When all these different pieces that have to come together to make sure schools are viable, we're constantly working with them to make sure that kids can actually stay in school and keep all those other health benefits moving forward in a very positive way. So I think we've done a very, very good job. I think the team deserves a lot of credit for being so proactive and constantly looking at what can be done. Is there a follow-up?
Sounds like it. Yeah, Jordan?
Yeah, so are there no other further guidelines or restrictions that are being considered right now? I mean, other surrounding states have done that weeks ago, like Vermont and Maine, and their numbers are far lower than ours. So are there any other types of restrictions like curfews or limiting crowd sizes? Is that
Looking at the data, and we'll always consider everything is on the table, really, and we've always said that. I would be very cautious to compare us to Vermont and Maine. Those are incredibly rural states, much more rural than the state of New Hampshire, especially the southern tier of New Hampshire. If your argument is that states that have more restrictions have lower COVID, that is absolutely not true. Look at California. Their numbers are up 30% last week, where all our numbers are down, and they have the most restrictive policies in the country. Look at what Massachusetts is doing. Their numbers, again, are higher, and again, they're putting more restrictions in place. I think it looks like even their numbers around New England, Connecticut, Rhode Island, Massachusetts, their numbers seem to have stabilized, and hopefully we're all at that level together. I think in New England we're kind of all tied together. So you can't just be so blanket as to say if we just do more restrictions, everything will get better. I had somebody ask me today, well, why don't we just be more like Vermont? No, we're not going to do that. Vermont has their own path, and I think Governor Scott's done a very good job crafting his own path for his state based on a lot of different variables. We have just very different variables here, very different density variables, demographic variables, health considerations, industry considerations, school considerations. It all just works a little bit differently state to state, and so that's why each governor is really tasked with crafting their own path. But I think the path we're on is very good. Again, the fact we're very encouraged that our numbers seem to finally start to be going down a little bit, and we'll keep watching the hospitalizations, and we watch this stuff this data day by day, sometimes hour by hour still, but we're on a good path here.
And Governor, we're going to circle back to Carol at Manchester Inklink. Carol, are you there? Let's try it. Carol?
Maybe she's muted.
Yes, yeah, she might be. We could try Michael Graham at the New Hampshire Journal. Michael, go ahead with your question.
First of all, Governor, thanks for wishing us a happy Festivus. We're looking forward to the feats of strength, whatever you're ready.
I keep looking out for the Festivus poll for all the cranks that are out there, but it is the holidays, so we got to stay positive, right?
And I've got a question, but first I want to start with your healthcare team from DHHS. Nashville is going to vote on a curfew tonight. They're pointing towards restaurants and the restaurant business being open after 9:30. As you know, numbers coming in from around the country. In Minnesota, contact tracing found only 1.4% of cases were traced back to restaurants. In New York, 1.7%. No, I have those reversed. California judge just shut down the entire state plan to shut down restaurants because the state presented, in his words, no evidence that the policy would have an impact on spreading COVID. Have you given any data to Nashville from the state level that would indicate that restaurants are a source of significant spread? Do you have any data to back that up? And is there any data that would show that a curfew would have an impact on reducing spread? Another question for that.
So no, there's no clear data that we see or have provided that say that restaurants are a clear super spreader or causing super spreading type events of COVID. In terms of whether curfews work or not, I would say this. This is just my anecdote, I've talked to a lot of folks in Massachusetts where they have instituted a curfew. And what we're being told is that a lot of folks, instead of being in a restaurant in larger settings later, and I understand the concept behind a curfew. They don't want large gatherings at restaurants late at night, and especially a lot of the single scenes and things like that in downtown Boston per se. But what's happening is a lot of those individuals, they're not just going home and saying, well, we're not going to socialize. They're going to someone's house, right? They're going to another private setting and sometimes staying later than they would. There's absolutely no real restrictions around that, no ability to monitor that. And so you're still getting this spreading type activity from social gatherings, the same type that they're trying to prevent within the restaurants, but it's actually happening behind the four walls of a private home now. So you got to weigh the good with the bad, right? It's like that tube of toothpaste analogy I always give. When you squeeze one end, something very well could give on the other. Folks aren't just going home. And so, one thing about having a restaurant setting here in New Hampshire and not pushing the curfew aspect is that restaurants, for the most part, are doing a good job of watching their guidance, making sure people are sitting down, keeping the number of folks limited. We don't allow just standing in large gatherings around the bar area or anything like that. So when you're in that restaurant setting, you do have guidelines that are in place that can allow people to be social somewhat, but still within the guidelines that and the parameters that we've put forward. And therefore, I think restaurants have done a good job and we don't see a lot of those super spreading events. So I'm not saying, look, if Nashville wants to create that is their choice to do so. I don't know if it'll have a significant impact in the numbers because, again, you still are going to get a lot of social gatherings, just not at restaurants, but back at home. Did he have another one, or did
I believe he does.
Oh yeah, go ahead,
Are you
Mike.
there?
And then, Governor, yes, I have a second question for you, Governor, about the economy and how New Hampshire's doing and whether or not you're getting some help from Governor Baker, because Massachusetts will be one of just 3 states that's entering the Transportation Climate Initiative. You announced in 2019 you were not going to enter it, took a lot of criticism at the time. Now, a plan that was supposed to reach from North Carolina to Maine only has 3 states in it. Even New Jersey, Pennsylvania, and the new Democratic governor in Maine have chosen not to enter it. Were you right, and do you anticipate a benefit to New Hampshire's economy when we need it during COVID from Massachusetts raising gas prices through the TCI?
So was I right in having us stay out of the Transportation Climate Initiative? Absolutely. There's no doubt about that. The financial impacts of that initiative are huge, and that's why a lot of rural states, Republican and Democrat, are saying, no, it's not for us. So effectively, that program would ask a lot of rural states to subsidize a lot of the larger mass transportation initiatives of states like Connecticut, Massachusetts, and New York. And again, if those folks want to rebuild the MBTA and all of that, I think that's great. But they should pay for it, right? I mean, how do I ask a taxpayer in Franklin to get another 20 cents a gallon on their gas tax so that they can subsidize the debt service on the Boston MBTA system? That doesn't make any sense to anybody. So of course, we were the first state to step up and step out of that. I know other states are looking to go forward with it. Yeah, that's their choice. Are we going to benefit from it economically? I got to tell you, if Massachusetts goes forward with it, yeah, I don't know how we wouldn't. And that's not why we're staying out of it. We're staying out of it so as not to penalize our citizens unnecessarily. But there's no doubt that if you start, putting 25-cent extra gas tax, especially around the border towns of Massachusetts, the Haverhill or Methuen, Lawrence, Andover, there's no doubt folks are going to come across the border to get gas and buy their groceries and get whatever else they're going to be purchasing. And we've always been ahead of the game in that area, and now it's going to really put us that much further ahead. So. Then you add on the fact that we're in a pretty big economic crisis in this country, and I've always said the last thing you should be doing is pulling another buck out of people's pockets when you want them to have some economic stability for themselves and their families. Then you add on the aspect that we're now more people are remote working, right? So all of the financial estimates of how much money that gas tax was going to bring in are likely going to fall short because more people are just working remotely, and therefore they're going to come back and raise the tax yet again. So this is one of those situations that could really snowball out of control in a very bad way economically. I understand if they want to do it for their infrastructure and investments, that's their choice by all means. But it's definitely not fulfilling, I think, some of the ideas of having all these states in it together as was originally visioned, and that will have a really negative impact on the finances and the reality of making some of those programs come to fruition.
We're all set on the phones, Governor.
Great. So I didn't know we were going to talk about TCI so much.
Sorry, just to follow up on vaccine distribution, we have a lot of older folks in this state who head south for the winter. So if their primary care physician is up here and their time comes to get vaccinated, how do you suggest they do that? Should they come back home, wait till they return in the spring, find a location where they are?
That's a great point. Come on up, Dr. Daly. Luckily, we still have a little time to work that out. That'll be more phase 2, phase 3 of the general public. Is that the answer? Okay. Yeah. For the most part. So what we'll do is the doctors are basically going to enter into a system that say, yes, we want to receive some vaccine. And then we'll communicate to them who gets prioritized as part of that. And then part of that communication, those health advisory notices, will include some of the recommendations and guidances, if you will, in terms of how to deal with folks that may be traveling, may not be back within a certain window of time for their second shot or whatever it might be. Luckily, within phase 1A, The nurses are there. The folks in congregate living settings and long-term care are there. So it's much easier to manage as we roll this out. And one thing that we're looking at is what's the uptake, right? How fast are people taking this up? It looks like a lot of folks are coming in to get that vaccine, which is very, very good news. But all those are variables that come into play as we really define the 1B, phase 2, and phase 2 priorities, as well as making sure that we have that communication system in place so folks know, for the very rare cases where they might not be available for their second shot or they're still looking to get their first shot. Can they get it in another state? How would that exactly work? Yeah. Okay, well, great. Well, thanks, everyone. We want everyone to have a safe and healthy, happy Christmas weekend, especially if you're taking time off. We thank everyone for the sacrifices they're making with some of their having their Christmas gatherings with immediate family mostly. And we just want folks to stay safe, that we are at the beginning of the end, to be sure. The team has done a great job. There's a light at the end of the tunnel. 2020 will be over soon enough, and I think we're really in a good position to make 2021 very successful. Thank you, guys. And not next week, but we'll be back the week after, right? So no press conference next week, unless something drastic hits. We're still on the job. We're still doing our stuff, but we know a lot of people will be traveling. So thank you guys very much.
So there you have it. Governor Sununu talking to reporters this afternoon about the coronavirus response here in New Hampshire. Let's take a look at some of the bullet points that the governor hit on this afternoon. First, some of the statistics. Right now we have 624 new cases, 6,458 active cases. That's a decrease of about 203. Total cases in the state of New Hampshire now at 37,528, and we currently have 297 current hospitalizations. Taking a look now at no new deaths for a second day in a row. 656, though, total deaths tragically across New Hampshire since the pandemic began. 52 deaths in the last 7 days. Also, Moderna vaccines now in place in New Hampshire. 24,200 doses in the state. Half of those now going to the hospitals. Half to fixed and mobile sites. That's launching Tuesday. High-risk providers not in hospitals and first responders receiving that second half dosage. Also, another vaccine for you, the Pfizer vaccine. We do have 8,875 doses in the state this week. Most are going now to long-term care vaccination programs. Now, also, as far as future vaccinations are concerned, we're expecting about 18,000 doses in New Hampshire each week over the next few weeks. Phase 1 vaccinations expected to last until mid to late January, and those are for healthcare workers, long-term care residents, and first responders. Phase 1B will follow that. That will include people with comorbidities and underlying conditions that put them at a significantly higher risk. Future phases not yet announced, but that will occur as we continue to march down the road. That's going to do it for right now. We'll have full coverage of this coming up on News 9 at 5. We hope to see you then. We return to our regular programming now.